I want to say thank you for joining us today on the session on reopening plans and lessons learned from other schools and organizations. Thank you to the staff here at A+ and to the members of the Pittsburgh Learning Community that have helped promote and get the word out about this event. Again, as I just said, our goal today is really to create an opportunity for a conversation that's really focused on problem solving. We want to, do some work around helping folks understand how safely, how schools can safely open in this time period, and then also do some work around understanding the challenges and opportunities that exist there. So I will briefly introduce myself. I'm James Fogarty, the Executive Director of A+ Schools. Our organization is committed to ensuring that all children, but especially Black and Brown children in Pittsburgh, have access to the education that they deserve. And joining me today are colleagues and panelists who I will let introduce themselves, but at least go through their names first. And on my screen, Dr. Shirley McElhatton, who is joining us today from her shift, who had another doctor help cover some of her rounds. So we appreciate her being here to support us. Josh Hanna, an educator focused on students with exceptionalities at City Charter High School. Missy, if I don't want to get your last name wrong, but from Boys and Girls Club, Missy Fuller, is that right? From Boys and Girls Club. And last but certainly not least, Kay Chase Patterson, the CEO of the Urban Academy School. And we want to thank them for their time. If I may, Dr. McElhatton, if you don't mind just introducing yourself, your expertise, and then if we could go through the panelists just in the order I just went through your names, just so you can do a brief introduction of who you are, where you come from, and then we'll get into the questions. And hopefully this will be a conversation that'll help all of us get to a place where we can start to understand what needs to happen to help our schools open here in the city of Pittsburgh. Dr. McElhatton?
Thank you. I'm Shirley McElhatton. I'm an internal medicine hospitalist. Primarily, I spend my days taking care of hospitalized COVID patients. I came to this issue initially because of my own kids' school. In the summer, they were opening plans. Obviously, I'm interested because it's school. And then I also serve on the board of a charitable giving foundation that our that aspect as well together made this an issue that I've been very interested in and have been following closely.
Thanks. I think we're having a little bit of connectivity issues with you, but we'll try and just so folks know. But if I think we were able to catch most of that. Were folks able to catch most of that? All right. All right. Great. Thanks. Josh.
Hi, everyone. Josh Hanna. I'm the Director of Special Ed at City Charter High School, which is a single building charter high school in downtown Pittsburgh. Faculty, staff, and students, we have about 625 people in the single building. I've been there since 2007, and I've been teaching in the classroom as a social studies teacher and special ed teacher from 2003 through 2017, and I've been an enrolled director since 2017.
Thank you. Missy?
Good morning, everybody. My name is Missy Fuller, and I'm the Vice President of Operations for Boys and Girls Clubs of Western Pennsylvania. We serve 14 clubhouses throughout Allegheny and Somerset, and we are partnering to do community learning day hubs for children that we can speak to how we have managed to reopen. And then also we do specialty programming and out of school time space as well throughout our clubhouses with partnering school-based locations, brick and mortar clubhouses, and community partners. I'm happy to be here. Thank you.
Thanks for joining us. And Chase.
Good afternoon, everyone. Thank you, A+ for the invitation. I'm looking forward to the conversation. I've been involved with the Urban Academy now for over 10 years. We are a single site, 330 student charter school in the Larmer community. We have been in a hybrid model since the beginning of the school year. And so I'm looking forward to talking about some of the tough decisions that we had to make along the way to get us to where we're at today.
Thanks so much for being here. So I wanted to start with this conversation because I think, part and parcel of this is we've not ever, at least in our lifetimes, lived through a pandemic that, at least in my knowledge, of this scope and scale. And, really, as Dr. McElhatton is someone who's serving patients with COVID, really wanted to understand sort of a broader definition of health, and the impacts that, both that she's seeing around it. And so wanted to start with you, Dr. McElhatton, around what impact does COVID have on schools, and what impact does not going to school have on students' health and well-being?
James, I think Dr. McElhatton's moving to a different location in the hospital right now to get better connectivity. So I'm not sure if she's back quite yet, but we might want to give her a moment.
I'm physically walking there right now, so give me 3 minutes. Okay, maybe 2.
All right, we can vamp on this. Speaking of, and we can come back to this definition of health. But one of the things, when I was thinking about this is, Chase, as you were thinking about opening, and you had the spring experience, what were you worried about for your students, who are predominantly Black and brown, if they didn't come back to school? And what did you communicate, or what kind of engagement did you have with families to understand their concerns?
What was most prevalent in my decision-making was a really simple question: how are the kids? How were they when we were not in the midst of a pandemic? How have they been during this initial shutdown? And how will they be if we're not aggressive in our approach at delivering quality learning experiences at the start of a new school year? That really drove all of our decision-making here at the school. However, I'd be silly to say that I was not then, and am not now, still afraid of the potential of an outbreak or someone losing their life as a result of this virus, and ultimately my decision to come back to school. However, I called every member of our staff, and said, listen, folks, there are certain risks that we can mitigate, and there are certain that we cannot. We can make sure that we have masks, thermometers, shields, face shields, hand sanitizer, soap, refit the water fountains, do all of the things necessary to ensure the best, safe, and most safe experience our students and staff can have. What we cannot control, however, is whether a parent can, by desire or not, create a quiet space for their kid at home. Whether a parent can sit beside their student and make sure that they're getting through the remote instruction. We could not control those things. And that's what we learned over the initial shutdown, is what we can control is how we can ensure safety, what policies and procedures we can put in place to mitigate exposure. What we could not control is the environment of a home space, which is not always the learning space, and it can't be. And so I talked to every member of the staff personally, asked how they felt, and everybody wanted to come back.
That's great. Thank you for that. And I mean, I think one of the things that we continue to think about is this, there, as you pointed out rightly, right? Like, there is this fear out there of, if we make a decision and someone gets hurt, like no one wants that, right? And I think that's doing the things that it takes to make sure you're safe, and that you're ensuring, right? Sounds like you talk to every staff member, that you're ensuring that your staff understands that you're doing everything to keep them safe, is a really important step. Dr. McElhatton, can you speak to some of that too, around, what are things that schools can do to make sure that they're safe, but also thinking about the health of the students in a holistic way?
Absolutely. I moved to a different location. If I'm still going in and out.
Good now. So.
Okay. If I am, just wave. I can try to hotspot on my phone. If that might, I'm at the mercy of the hospital Wi-Fi, so I apologize. So it's a great question. And I think we've spent more time this year thinking about health than we ever have, at least since I've been practicing medicine. But we've come to equate health with a lack of COVID. And there's so much more to health. And we know that, but when all we see is COVID and on the news and on the TV, that we forget that health, and WHO has a great definition. And I try to keep this in mind because, again, I take care of COVID all day, is that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And once we start thinking about health in that way, remembering that that's what health is, it kind of clarifies what we're doing. And if the question is, what's the impact on students' health from not being in school, then we have to A, keep the health definition in mind, and B, remember that any impact of an intervention requires us looking at risk and benefit. And if we're not doing that, then we can't see what our impact is. And we know that the risk of keeping schools closed, I mean, you've seen it, I don't have to go through it. I have tons of resources if you want information more specifically, but their physical health, the obesogenic environment that virtual school is going to impact the obesity epidemic in our children for years. And it's not going to just go away when we go back to normal. The toxic stress in children rewires their brain in such a way that this anxiety and depression that they're experiencing now will not just go back to normal once we do. The effects of what we're doing now on their physical health and their mental health, we will feel for years. We don't even know what we're up against, but the research that is coming out is showing that it is affecting kids more and more and at longer intervals, and has a potential to be there for longer and longer. Socially, they're withdrawn. They're not meeting milestones. There are clear defined milestones that kids should be meeting socially that they're not. And again, we don't know how to get them back. So the risk is clear. And again, I have tons of resources if anyone's interested in more details. So then we need to ask ourselves, what's the benefit of the intervention that we've chosen? And early on in the summer, it was very clear that the perceived benefit was going to be that less people get sick and less people die of COVID. And that's a very laudable goal, believe me. However, now that we've been doing this for a year, we know that that benefit hasn't shown. It made sense to think that it would, but it hasn't. Kids in general get COVID less than adults do. They're like 44% less likely to get COVID than an adult. They're 10,000 times less likely to die from COVID than someone over the age of 80. Someone less than 20 is 10,000 times less likely to die. This is not a pediatric illness in general. But then you think, well, but putting more people together in a building will certainly cause COVID to transmit. And we have, again, tons and tons of studies, good ones from UNC, from Wisconsin, from Sweden, from Norway, that show not only do they not transmit in school, school is the safest place. There's a great study from Sweden that shows that there's actually better outcomes for people who teach in buildings than people who teach out. It was quite interesting. And then, so it's not like pediatric illness, it doesn't transmit in schools, but does it somehow bleed back into the community? And there's great studies from Germany that show that it doesn't, that schools aren't a super spreader when they're in schools, and it doesn't bleed into the community either. They actually, when schools were in and out in Germany, they have rolling summer vacations. So it was actually a really interesting way to study it. There was less COVID in the community when kids were in school. That's probably because of the controlled environment. And what these schools did wasn't like rocket science. The schools, the UNC study, the Wisconsin study, they masked and they physically distanced. And other schools had other things, but in general, that was the intervention that caused safe openings. So we know the risks, we know the perceived benefits that didn't actually occur, so they're not benefits. So now we talk about impact of an intervention. The risk-benefit ratio is obvious to me, and particularly when we look at holistic health.
Thank you for that. I wonder, in thinking about that, I'm going to shift speakers, but we'll come back. Josh, when you're thinking about, because there is a lot of concern around older students and sort of the spread there. And, there's been great studies around kind of K-5 being less likely to spread, but older students, sort of how did you engage, how were you engaged as a faculty member? How did you engage students and families in a conversation around, bringing some students back? And also, can you explain for folks on the call sort of what your model looks like right now, and what's it looked like throughout the year? Because I think, we should be honest about, like, it's not been one kind of thing the whole year long, right? So just wanted to get a perspective from, from you as you serve older students.
Sure, and it's been flexibility is the term we've been using a lot of pivoting and shifting. And like you said, first about City High, we're on trimester calendar, so we're fortunate that we were not in session in August and December, so we had time to stop and reset between trimesters, and we did in fact change models. Our goal was, to implement an in-person hybrid based on family choice with the fully virtual option at the start of the school year. But based on a process that led us to this model, we never implemented. We were still fully virtual for all of trimester 1, September through the beginning of December. But leading up to that, the whole in August and in July at the end of the school year, the process we used administration, just stakeholder information from everybody, similar to what Chase said. Every staff member, even including non-teaching staff, concerns about safety, opinions. Every parent, every student had the opportunity to participate. This was mostly done through surveys initially, but then once we gathered that data and formulated some options for a model, then we offered town halls, both to City High staff and the greater community, parents, students, anyone interested. Ultimately set out another survey. Here are some options based on our input for a model for the fall. And ultimately we decided on a hybrid schedule, but it was the same day, AM, PM groups instead of daily groups like most schools have, for a variety of reasons. And our staff at City High worked hard, with signage. We had masks for everybody, face shields for everybody, hand sanitizer stations set up everywhere, arrows, sort of lessons and curriculum designed to teach the students these mitigation techniques, and not only teach them what to do, but why we're doing it and why they have to do it, especially at the high school level. And then we were fully virtual September through December, but we realized about a weekend that students were struggling at home because of cultural barriers at home, barriers outside of their control and our control. So we quickly implemented an in-person weekly day. Every Wednesday, students could volunteer, self-select to come to the building to get in-person support. And I was there, the admin team was there, multiple teachers per grade level, and it was a big success. All the mitigation techniques were in place, the students learned them, agreed to them, followed them, and we had about 20 to 30 students per grade level that came every Wednesday. So we had a significant portion of our student population, which averages between 500 and 550, depending on the year. So that was the first trimester, and then we were off in December. So we went through the same process again, where admin followed all of the same data and opinion gathering vehicles, in addition to obviously in communication with the AIU and other constituents in the county. And we decided to pivot and change models. So then we went to a hybrid daily, AB. And we did this for a couple reasons. One was we wanted to implement in person as quickly as possible. So we needed something that we could provide virtually that could pivot and be the same for in person. Unfortunately, we have not been able to implement that. We're following the counties if we're in moderate or substantial, and teachers are actually coming back next Tuesday, and we hope to bring the students back within a couple weeks if we hit moderate and stay there for 2 weeks. But it was the same process, and what we lost was that Wednesday in-person support day. So we quickly realized that, well, yeah, we're now extending screen time, making classes larger because everybody's going full day now, not AM versus PM. and it's harder on teachers. It's a new model that they have to learn. So based on input, and also another fortunate characteristic of City High is that our school day is longer and our school year is longer. So we exceed the PDE's requirement for hours for charter schools per year. So we were able to, in this new model, quickly pivot again, and we don't have classes on Mondays. So we have classes Tuesday through Friday virtually, but on Monday is when on Monday is when teachers don't have classes, so they can really offer additional support virtually. In addition, and also catch up on grading and planning and take care of their mental health. And because we lost that Wednesday in-person day, we lost the in-person support. So about 4 weeks ago, we implemented the targeted in-person support, and we brought in 15 students per grade level of our most vulnerable students, students with disabilities, English language learners, students with attendance concerns, students with cultural or home barriers that we can't control and they can't control. And we offered them the opportunity to come to the building. So they still follow their virtual class full day, but they do it in the building. And with that targeted group of students, in just 3 weeks of data here, everybody has improved. Now, to be completely transparent, some have been very slight improvements, but now their attendance is off the table. That's not a concern. But for a majority of the 60 to 70 students that come for the daily in-person support, we've seen significant improvement. So they are recouping their skills and performing where they were pre-pandemic. So our hope is that can start, like I said, all staff are coming in next Tuesday to start to practice delivering the hybrid model, live streaming included from the building. And with this 60 or 70 targeted support students, they're going to start to follow their schedule. So they'll be face-to-face with all of their teachers. And we'll get a sense of how they move around the building to make sure our signage is correct and appropriate. And then hopefully if the county reaches moderate for 2 consecutive weeks, we're going to implement the full school in-person hybrid on a voluntary basis immediately.
I mean, just describing all of the flexibility that's built in there and all the engagement. I mean, I think one of the things that it's really telling in that story is, the ability to adjust over time and to really continue to keep the students at the center, right? And figuring out how to serve them. Josh, thanks. Chase, I didn't ask could you describe your model too right now? Just, I didn't have you do that. And I think just it'd be helpful for folks to understand kind of how you're working it right now.
Yeah, sure. We've got a hybrid model, AB schedule, closed for deep cleaning on Fridays. Any student any family that elected to be in a hybrid model was able to do so. And those that chose to remain virtual patch into the class in real time each day for all subjects.
And what percentage of your students are back in person versus those that are sort of fully online?
We're about 50-50.
Okay. Thanks, Chase. I appreciate that. Missy, so you are seeing our students from all kinds of schools in your learning hubs. Talk to us a little bit about kind of what you all are doing in terms of supporting students from multiple schools at different sites, and what you're seeing in terms of student learning and support, and what would you need to support learners better? It's a lot, but
yeah, no, I thank you so much. And I think, there's a overarching topic here, which is, families have to feel trust. The students have to have trust. They have to ensure that the supports that we're implementing in place are allowing the best possible environment from a safety perspective and a learning perspective. And, I think that building this, it starts at the very beginning, and it has massive amounts of facets that have been discussed by some of the colleagues on the call today. But I also think that, it continues to evolve, flexibility, fluidity, it continues to evolve as we continue to navigate this COVID. It doesn't stay the same from month to month or week to week. And so I will say, I think it would be very helpful for me to share a true overview of some of the steps that we've taken in our organization to get where we're at. And again, I'm going to continue to share and say it's ever evolving. But you had to respond pretty quickly to, CDC guidance that came out. We work with Office of Child Development and Early Learning to look at their suggestions that they have. We continually monitor all of the communications that continue to come out and be supported surrounding this. We built a health and safety policy. I think it's crucial to have that. It is your lifeline to how, the why, the what, and the when. We continue to share that with our families and our staff, communities. Let's all work together on this, to be honest. We do have a national organization that supports us from Boys and Girls Club of America, and they've been contracting with national experts to, talk to us about, some essential care participation policies they've seen throughout the United States. So that does help support, as you're looking at it, not just from a local perspective, but a national perspective. We immediately contracted with a professional cleaning organization. They come in nightly. Cintas is a provider of ours. They're bringing in hand sanitizer, face masks, toiletries. We utilize their disinfecting mop service so that the mop heads are being disinfected nightly. We went and purchased infrared thermometers. All of our clubhouses, we do daily temperature checks at entry and midday. We implemented a Google form. We ask multiple questions to identify if there's any possibility of exposure, and then we don't allow them to stay in our clubhouses in the event that there's a possible exposure to help stop the spread of this. We also purchased hydrostatic machines. And I think it's important to say that, currently we're running programming in 10 buildings that are in person, 4 partner sites that are in person, and 5 virtual programs. And so we've had a lot of experience at navigating this method and model to create an environment that has been proven to be safe and trustworthy across the families that we serve and the students. When families enroll in our programs, in our clubhouses, they get the health and safety policy as well as a waiver of acknowledgement. We're not allowing families to enter our facilities right now to obviously stop the mass amount of individuals that are coming in. We did stop in-person volunteers with the exception of our relief effort distribution center that we're holding in McKees Rocks. Some other information, we thought about group sizes, how we assign staff to youth, identifying a 1 to 12, but they stay with that staff and those same youth every single day throughout the weeks. They're standing, to kind of, support documentation that has already been shared, but they're standing, walking, and sitting 6 feet apart. They're wearing masks the entire time that they're there unless they're eating. Their meals are being served in a group of 12 with 6 feet of social distancing, or they're eating in their classrooms at their desks that they're assigned to. We did identify an isolation room. So the event a child would become sick during the day, there's an automatic location for them to go in our clubhouses. Our plan, the health and safety plan that I spoke about, it does speak directly, and it's very clearly communicated to what we do in the event of a case to arise in our clubhouses. It's viewable on our website. It's posted in the clubhouses. I think a crucial thing to say is I'm really proud that we haven't had an outbreak in our clubhouses, and we've been doing this since April of 2020. And so, the other factor I think in building an environment that isn't, you heard social emotional, you heard, people that are feeling this, impact, and the kids that are feeling this impact and what that looks like. But our learning hubs are at no cost to our families every day from 7:30 to 3:30. Huge thank you to Allegheny County Department of Human Services for supporting us on this. And they've been an essential partner to the hubs. They're bringing all of us together. They've shared resources. They're supporting the expenses of this. We also continue our day after the learning hubs to do after school programming, specialty STEM, sports, to try and give youth the opportunity to have that kind of normalcy, right? And be able to interact, but still meeting that CDC recommendations, OCDEL's directives on how to, ensure what is a safe practice. On average, our clubhouses are serving 70 hours a week of programming in our school-based and partner sites. Thinking about equity in mind, families don't need to worry about how to afford daytime care or enrichment while their schools are closed or in a hybrid model. And we're able to have a communication plan where we are communicating within 24 hours using our information management software, tools like Remind, which is a text alert system. Over communication is essential in this process. I can't say that enough. And then building trust is just, doing it from start to finish, having a plan, implementing the plan, seeing real outcomes has allowed families to feel that safe environment. We listen to them, we give them opportunity to ask questions as often as possible, and they have to feel heard, they have to be comfortable, and it allows them to be in an environment that they really truly feel safe. We've received compliments from our families that say, this has been amazing, and I'm not worried, and I've seen that COVID is not spreading by my children coming to your hub, and they're learning. We're working with multiple school districts. Some of our clubhouses have eight different school districts, which means we have 8 different kindergartens, which means we have 8 different, connectability options where we're trying to support kiddos on logging on. The content looks different from day to day. Thinking about how we do this, we are doing mentoring and tutoring. We're partnering with outside organizations that are volunteering virtually. We brought in AmeriCorps Keys members to be an additional support to the programming that we're doing to try and give these youth every aspect of opportunity to learn in an environment while still thinking about that learning gap that's going to be there for a very long time, and how we are strategically navigating our operations moving forward. And so, I'm a person that could probably talk about this for days, but I will say, I think it's important to share, it isn't just an easy answer. It's from start to finish, and you're navigating every single aspect from an operation standpoint, from a safety standpoint, to a social emotional standpoint, to a communication standpoint. And it's you navigate it as you go. That's the best example I can provide.
I thank you so much for that overview, Missy. I really, really appreciate it. And now we've kind of gotten a sense of it. Dr. McElhatton, and hearing some of the things that you're hearing from our schools, any thoughts on what you're hearing about sort of how they're doing this work? Any ideas, any recommendations, right? Like, this is also a great opportunity for some knowledge sharing as well, that you heard that you want to make any comments on.
This doesn't have anything to do with being a physician. It's just the amount of input that the successful programs have gathered from their stakeholders, I think is the thing that stands out to me the most. Is if you want to do this successfully, you have to get all your stakeholders on board, and they have to feel that they've been heard. The school district that my kids live in has had quite a bit of discord in the community, and I feel that much of it could just be solved if everyone felt they were being heard. That's unrelated to my profession. But I have to say, Missy, when you were saying that you were surprised that there was no outbreak, I'm not. I'm frankly not surprised. The data that we have from Europe Europe did not close schools throughout any of this. Sporadically, but in general, Europe has kept their. So in August, we had that information. It still was unknown because things look different in the U.S. than they do there. But we've adopted essentially the same policies that they have as far as masking and physically distancing. And there's going to be some things that slip through the cracks. But if we do those simple things and we do them well, that we are going to be successful. And frankly, I'm not surprised that you have been.
In talking and thinking about that input and engagement, and this can go for anyone, sort of what are some of the conversations you've had with families that have helped those that are coming in person, understand that what you're doing, their child will be safe, right? And I guess the same too goes for your staffs, right? Like, I think when I think about this issue of like opening schools safely, there's really 2 key constituencies we want to make sure know that they're going to be safe, know that coming back to school will be, that they're not going to put their health at risk. And that's our staffs, our teachers that are in the building, and then our students, and sort of just wanting to understand kind of how those conversations happen. Josh, you talked a little bit about the town halls. I'm curious to hear a little bit more about those and how they were framed up, and then maybe Chase and then Missy.
Sure. Town halls took on a variety in what they looked like, throughout the year, because, it's a little bit ironic that, we've learned so much more about this pandemic now, and we're waiting for the county to get to moderate so that we can have more in-person learning. Whereas in the fall, a majority of the staff, the family, and the students were afraid, myself included, to implement an in-person learning model. But when we look at the chart on PDE, well, we were in moderate from September through November 15th or something. So that part's a little ironic. So those town hall conversations have really changed. I think people are starting to realize everything that we've talked about so far here, where schools are a safe place and the importance of it, not only from a learning perspective, but from a mental health and health overall perspective. We have a pretty amazing wellness suite at City High where we have a licensed clinical social worker and a professional therapist that are on board full time. And they've been coming in for these in-person support days in the fall, and now they're in daily for the targeted in-person support. And some of the students that come in for this targeted in-person support, it's because we've heard from their families, and we're in constant communication with families. Yeah, they didn't need help logging on. They have a good workspace at home. They can work independently and follow along virtually, but they were really missing out on that mental health component. They weren't getting that treatment. So we included students like that in our targeted support. And that information came directly from the families and from teachers and advisors, just establishing that relationship and consistently communicating with them. So, we know that, this person would benefit from coming in. And we have students that come in, and like I said, it's 60 to 70 students right now. And our wellness suite is a revolving door of students who are, they're in the classroom working virtually with support. As soon as wellness is available, they're down to talk to one of the counselors. Shifting gears a little bit, talked about stakeholder input. And one thing I just want to be transparent about is that, we gathered all of this input, and our admin team really took it all into consideration and then came back with options before a final plan. So we really had a lot of input along the way. But I also want to be transparent that it's never been unanimous. Whatever plan we use, there are still staff, parents, and family and students that are a little concerned about coming back next week. That being said, admin has provided what's called the teacher resource guide for COVID, and it addresses in detail a lot of the concerns that were raised at these town halls or staff meetings or via email directly to admin, answering concerns and what to do in different scenarios. And obviously there's nuance in that, but it's a nice guide, and it's a lot of work for admin to put that together because they had to do it twice, once for each model. So we got a teacher resource guide in the fall for that model. It's about 7 pages. We got a teacher resource guide for this model in January, and that resource guide is going to be revised. I think they're going to get it to us tomorrow before everyone's back in building Tuesday. So that constant, not only gathering the information, but then using it.
Yeah, it's important. Chase, talk to us a little bit more about sort of how, I know you had the one-on-one conversations with your staff, but in terms of the families, you said you've got like 50-50. What have the conversations been like in terms of the flexibility that you're providing, and also for those that needed to be in school? What have you been communicating, and how have you been continuing to do that?
Sure. Let me start by saying there's not really been any clear direction or leadership from those folks that we would expect to receive it from, i.e. PDE. So let's start there, and let's acknowledge that as an individual school, we had to make the decisions that were right for us. So there are some things that the Urban Academy has done that are different from City Charter, that are different from Environmental, different from Pittsburgh Public, and that's by the nature of how we are designed. Now, it is our philosophy at the Urban Academy that we do our work in the interest of public good. And therefore, if our work is in the best interest of the public, and we understand that our work is absolutely necessary to produce good quality learners and good citizens, then we had to come to work. There was no other way for us to do this. We had to come to work, right? So it became our responsibility as an administrative team, our board of trustees, our teachers, to figure out how we did it safely. And it really, I don't want to make it sound or seem easy, but once that trigger switched in our mind that going back to work is what we're going to do, we figured it the hell out. We just had to. Our students, the students that I serve, are so disenfranchised, have been, their families have been for decades, generations, centuries, have been locked out of a quality public educational experience. And so we see it as our charge, as our mission to deliver top caliber quality education every single day, to ensure that our staff and our students are safe every single day in the best interest of what's good for the public. That's how we see our work. So if it meant that we're in school 4 days out of the week instead of 5 because we need to do a deep clean that 5th day, so be it. If we have to spend more money on a cleaning company to come in, so be it. If we have to buy thousands upon thousands of masks so that a student never doesn't have one, or a parent, if they need some at home, can get them, so be it. Everything that we had to do to create the trust that Missy was talking about, to create the buy-in that Josh was talking about, we did it. Fortunately, the Urban Academy, families are here because they trust us already. So we didn't have to earn their trust. We've already got it. We just had to solidify their trust in us. We had to demonstrate that we were sophisticated enough to take the necessary risks to deliver quality education to their children, whether that was in the building or at home. And that was completely up to them as a parent, as a caregiver, to make that decision. So we left it up to them. It really wasn't about, do we go hybrid or do we stay remote? It was, we're going remote. And we have to do this because we don't know anything about this. But when the fall came, we're going hybrid. If you want to come, great. If you don't. But we're going to be in this building working. And that was our approach from the top down, from the left to the right, all around. We do work in the best interest of the public good by any means necessary. And if we are frontline workers, essential workers, and we are absolutely necessary to the best of the public interest, then we have to be here. We have to do it the way it's supposed to be done.
Thanks, Chase. I appreciate that. Thinking about like that, right? That charge, right? When have you had any outbreaks or other issues that have come up that have made that harder for you, I guess, and when in thinking about this, right? Because that is the ebb and flow of this, in trying to keep your folks safe, but to also meet the need of the public good that you're trying to get to. How have you handled that? Or, is it all mostly what you've seen come from the outside in, and then you've managed to keep folks safe that way? Like, just trying to understand sort of those dynamics too.
Yeah. By the grace of God, we've had no outbreaks, but we've also been hyper vigilant, right? So there are common cold symptoms, a runny nose and a cough, that are COVID symptoms. And so if a kid comes into the building and they've got a runny nose or a cough, or they've got a headache, or they're a little nauseous, they've got to go home. And they got to go home for either 10 days, or they've got to come back with a negative COVID test. That's the protocol. That's what the CDC says we're supposed to do. That's what we do. And it's sucked because, they got a cold. They stand at the bus stop and wait for the bus in the morning. They got a runny nose, but hypervigilance says, go home 10 days or get a negative test and come on back and let's go back to work. But when you go home, you still have to come in remote. Mm-hmm. We got work to do. So there are no free passes at the Urban Academy.
Well, I appreciate that. Missy, can you talk a little bit about, in terms of the supports that you're able to provide for students? Like, you talked a little bit about through AmeriCorps, but what have you seen that students need from you? What have you been able to provide? And then where have you been able to partner either with specific schools or school districts to get that extra support that you might need? Because I know, teachers are doing a lot online, and I've talked to Hub staff who've been like remotely helped to help a student by a teacher online, but sort of how is that working from a remote standpoint for you all?
Oh gosh, I mean, it's everything, right? We can't do what we do without partners. I'm just gonna start there. I mean, I spoke about Allegheny County DHS. I spoke, a little bit. I mean, I may have not, or I have, but Greater Pittsburgh Food Bank, the school districts that have been sorting us from the food perspective. I mean, I know that doesn't seem like that's a big deal, but I will tell you, it was a huge deal in the very beginning on how we're going to serve kids food. And through the CACFP food program, there was variables of when you could serve a child a breakfast and a lunch, and when you could serve them a dinner and a snack, and who was supporting that. And thank goodness for Eaton Park. And, I mean, there's so many factors from, there's basic needs. There's learning, there's educational needs, there's the supports from, having the tutoring and the mentoring component, but there's also basic needs. And so, thinking about how we as an organization handle that, I mentioned AmeriCorps. I mentioned that we have organizations that are volunteering to do virtual tutoring after hours at home with the children. We have a program called Club on the Go. And United Way of Southwestern Pennsylvania has been another huge partner of that, supporting the transportation efforts. But any family can say, I'm in need of water, food, cleaning, hygiene kits, whatever it might be. We deliver it using our vans right to their home. Partnerships such as Lowe's. I mean, the list could go on and on and on. And you have to be available to be able to partner, and you have to we look to OutSchool. OutSchool is a virtual platform for offering online classes that are more of a geared towards a STEM or a sport or social emotional, or how to do the hula, for goodness sake, right? And honestly, partnering with that and saying, this is what kids need. They need an interaction. We did that. We continue to navigate what the needs of our families and our communities are by listening to them. And uniquely, we get to see them every single day at drop off, and we get to see them every single day at pickup. And we mentioned using text alert apps. We mentioned using our data systems. We mentioned, sending out communications. We had communication plans built and ready to go. And what I mean by that is, if COVID breaks out, we use this communication. If this were to occur, we use this communication. How are we? You have to be prepared and planned. I think I heard that multiple times today. You have to be prepared. You have to be planned. They have to trust. Families and staff and students have to trust the work that you're doing is going to keep them safe. And you have to be able to give them the supports. If you have a child that is an ESL learner, and they're trying in kindergarten to navigate to a platform where they're learning their colors and numbers with 12 other or kindergartners, it's a difficult task. How are you going to give them what they need? And it's saying, okay, this is what we're seeing. How do we get help? Who's our partners to help us do that? And so I think, how we offer supports is we continue to find partners that are going to work alongside us to be able to do whatever it takes. That's our mission, to support these youth, to advocate the potential in every one of them, no matter if they're a kindergartner or an 18-year-old, and so I think, that would be my statement for how we are offering supports, is we just continue to be fluid and add where need is greatest.
That's great. And to follow up on that, Missy, how are the children doing? Right. Like, I think I'd ask this for all of our speakers is, how are the children? Right.
Yeah.
Yeah.
I thank you so much for asking that, because, it is everything we do. We all serve the same purpose, and it's our kiddos. And I will tell you that in the beginning, masks were like the worst thing that could have ever happened. You say, mask up, put your mask up, put your mask up. And they're like, oh my goodness. And they're figuring out ways to make them, feel better. Right. And so I will tell you, like, they walk in today and it is not even a question. They know the process. They know they get their temperature check. We ask them the same questions. They go to their class. They're wearing their mask. It's normal for them right now. They play. They understand 6 feet of social distancing. Pool noodle tag has become like the hottest game in our clubhouses. And I'll just tell you, they're adapting. However, it would be, remorse of me to not say that there is some fear that exists really in the kiddos. There's some that are struggling, that are saying, the virtual piece is getting exhausting. I think I hear adults say, like, Zoom is getting exhausting. And I will just say that, we continue to navigate it, but they're okay. And they're happy, and that, they know their routine. That, children are nature of routine, and they know it. And so, yes, it's adjustment in the beginning, but they figure it out, and they figured it out pretty quickly. They adapted very quickly. And so I would say our kiddos, they're happy to be doing stuff. They're happy to see their friends. They're happy to be able to, interact and not in a virtual platform all the time.
That's great. Chase, how are Urban Academy students doing, children doing?
I mean, I would say the same as Missy. I would venture to say that any kid who's been able to go to school or be around their peers, any human being that's been able to be around other people is probably doing better than a human being who isn't and who hasn't had that opportunity. It's just, like Shirley said, it's about more than just your physical health. It's about your mental and social health as well. And what we are doing when we're inviting children back into our buildings is giving them an opportunity to recharge their social health, to recharge their mental health, and to recharge their academic health. Because anyone who leads us to believe that remote instruction is equal to or greater than an in-person learning experience is full of shit.
Yeah, I mean, the data from our cyber charter sector for years, and no offense to any cyber charter folks on here, but the data hasn't been great for a lot of folks, right? And that's why cyber charters have built in-person places and locations, right? Because they recognize that there's a need for that in-person piece. Josh, I'm curious, how are your students? I mean, it sounds like you guys were really in tune with that need by creating that Wednesday drop-in, but how are the children doing right now for you?
I'm going to echo the same thoughts. If the students are coming to the building, a significant improvement, not focusing on academics, but socially, behaviorally, their mental health, it's improving exponentially. Also, the teachers who have so far volunteered to come in on these support days, they're happier as well. I try to get in 2 days a week, and I really enjoy those 2 days better than sitting in my home office. So, really looking forward to next week when the entire staff is back, and everyone gets to experience that, and we get to really practice all being in the building together. I think our spirits will be up, morale will be up, and then hopefully bring the students back, and they'll follow the same plan.
That's great. Dr. McElhatton, can we, you're in a district where students are back in person. How are they doing? How are your children doing, and how are the children doing in your community?
Yeah, the same. I don't have nothing scientific about this, but they're, when they walk through the door from going to school, their presence is so much brighter than when they slog down the steps in their pajamas for their 8th snack of the day in between periods. It's astounding. And I've sort of been identified as someone who cares about this. So I have tons of people that just come to me and telling the stories of how much their kids were struggling. Because we really did just start going back a couple weeks ago. Their kids, and not academically, they're not struggling academically. They're struggling mentally and socially, and they're unable to find therapists that are even taking on new kids because they're also overwhelmed. And just being back in school a couple of weeks has lightened the moods of those children that were even struggling, more than mine.
Yeah, I mean, I think around that mental health issue and thinking about if, especially as we think about the broader community and going back, getting more of our children in place, like, what are you all planning? I mean, it sounds like City High's got, but like for others, like what do we need to do to start planning for that mental health support that might be needed for lots of our kids, especially kids that might have been out of school since last March, right? And what can we do to support them in that engagement? Because I think I read one article where it's like, I don't know if we're ready, but kids are going to come back on fire, ready to learn. And are we ready for them? And so just, kind of thinking through with you all as a panel, what are you thinking about kind of through the summer and into the fall to support those students as they do come back, as parents feel like it's safe again, as vaccines go out? What are you thinking in terms of those supports? I'll just kind of open it up to whoever wants to respond on the panel.
I'll
think
go
it's-
first quickly. Oh, I'm sorry.
Go ahead.
I think what's going to be really important is that we ask the question of all the kids, not just kids that have been identified as having issues prior. Previously healthy children are going to have to be asked. We're going to have to dig deep. We're going to have to really uncover, you know, kids that might be struggling now that weren't previously, and the supports. We're going to have to build this from the ground up. I think this is unlike anything we anticipate, and we're going to have to be willing to go big with the mental health support that's going to be necessary when this is over.
Josh?
I was just going to add that even though, our, like I said before, our wellness suite is really outstanding and we have full-time staff, we've learned just from the portion of the student population that's been back that they're not going to be able to handle that themselves. So we've already begun, as recently as this week actually, thinking about how to get more support people in there, into the building, so that students aren't sitting in class waiting their turn to see one of our two therapists or social workers.
I would also like to add to all of that, but I would also say, you've heard me say partnerships quite a bit on the call today, and we don't have to reinvent the wheel. I think that there are partnering organizations that can push in and help to be ready for this mental health crisis that's going to occur. I mean, it's going to happen. And kiddos that you would think in the past that didn't have a concern there, they might very much, I agree with the panel today that we're going to have to be ready to ask all children. It's not just specific children, but I do think, like, why reinvent it, or why try and figure it out on your own? There's organizations that we can partner with that can push in to help with this mental health and therapy, from every angle, and continue to grow that partnership. It's important.
Yeah, I agree with everything that's been said. We are planning and preparing for the upcoming school year, assuming that not every student will have a vaccine and not every member of our staff will have elected to take one, that families will still be given an opportunity to elect for a remote experience. So we are designing what that experience will look like based on what we've learned throughout this year and last spring. But we're also acknowledging that it's going to be a manpower issue. We've got to have more instructional support in the building, smaller groups, to ensure that our students we're plugging those holes that exist as a result of the pandemic. And then we've got to innovate around how we are delivering our family support services. Though the traditional time frame that we provide here at the school is during the school day. That's got to change. We've got to add more people to the infrastructure of that office, and then we've got to deliver those services in times that are more convenient for families. So the weekends, after 5, in the evenings. And then, last but certainly not least, we've got to continue to champion for equity, for resources to support what we know will be continuing challenges over the very foreseeable future. For many years to come, our students are going to be hampered by this pandemic. And so we've got to champion and challenge and advocate for appropriate and equitable resources to support the development of our students, particularly those who have been most left out in the public education system.
Are we thinking about that? Like, what are you all thinking around in terms of summertime, summer school, or tutoring? Like, what programming are you gonna offer or be able to offer? I think there's some federal dollars potentially coming on this front that we want to make sure support educators to be able to get in the classroom and work with our students in the summer. What are you all planning? What are you thinking about in terms of the next few months and kind of extending learning where you can?
We've developed an HBCU tutoring corps. So we've got HBCU students from across the country who are tutoring our students now, those families that have elected to do so at no charge, of course. And they're going to be leading our summer enrichment work as well. we don't want to create a program that looks too much like what we've been doing, because participation won't be as high and engagement won't be as high. So we really want to tailor it around our students, ensuring that they can still enjoy a summer while getting those skills that they need, all of which, and I haven't talked much about this, is data driven. We are still assessing as best we can. We're still identifying those areas as it relates to standards and other measurable outcomes for students. We really want to know where they're at, and we've been able to track that data as best we could since last March.
That's great. Josh or Missy?
I think I would say, that we, and when I say we, I'm speaking specifically to the out of school time providers and the childcare providers that service are stepping up, to meet head on with this challenge, right, in this current environment. And what we're really, really strong experts in is out of school time programming and summer camp programming. And I would just say that, again, it doesn't have to be reinvented. We're here. Contact us. We will come and we will run amazing summer camps that we're known to do in partnership to support that learning gap. Like that's where our partnerships really need to truly blend, is that this investment is there. It's been there all year and it needs to continue to extend. But we're here and we're well versed in the summer camp space. We've had them for many, many years, and we program like no other. Most of us do thematic programming where there's a theme associated to them. And I would just say, reach out, let's partner on it. Let's figure out how. If there's federal funding coming down, then that's a beautiful partnership that we can continue to extend the work that we've been partnering on now during some school closures or hybrid options. But we're here, we're ready. I welcome anybody. Please call me, contact me. I'm happy to help. I'm happy to connect us. And, like I mentioned before, we've got partners. Allegheny County Department of Human Services is one of them. And so there is an opportunity to be able to spread this across our communities widely.
That's great. Thank you.
And we're on trimesters, like I said before, so we'll be out of session here in April, but then we'll be in trimester 3. Full go in session May, June, and July. And then in August, we do offer a traditional extended school year. So like Chase says, it's going to be data driven. We're going to continue to collect data to see what our students need in addition to the academic support, and look at CCS or just some general programs that we can develop and implement based on their need to offer simultaneously in August. And like Missy said, we also look for partnerships with some camps, just try to meet every student's needs. So we'll continue to collect data. There will be some more consistent services as we go through July, which is nice for us. And then we'll see where we stand in August.
That's great. Thank you. I think one of the things that I keep thinking about just for my children, right, who've been online this whole year, is just that when they have been able to be with other students and other kids with masks, even how much they brighten up, and wanting to make sure that we can get to that point sooner rather than later. And with the we've talked a lot today about how we can open up safely. Is there things that we can be thinking about though as vaccinations roll out? Like how do we think about that too, to add another layer of safety or another thought around this, so that folks feel more comfortable about getting kids and adults in person together? Because I know, we have limited supply, it's ramping up. But I'm going to lean on Dr. McElhatton a little bit just to think about how do we make sure that the right folks in our communities are getting the vaccines, and we're doing what we can in terms of the interventions, the public health interventions, for those that aren't able to get them right away, so that we can get back in person safely sooner.
And James, can I add a question to that? Dr. McElhatton, can you talk to us about the vaccine and whether it creates immunity from actually getting the virus, or if it just protects against the symptoms? I think I know the answer, but I want to be sure.
So the trials were not designed to determine whether or not people get COVID RNA in their nasal passages. COVID, the word COVID is a symptom-driven diagnosis. So in order to have COVID, you have to have symptoms. So as opposed to presence of virus, which we've certainly gotten confused, and we don't really talk about it that way. But so anyway, the trials were designed to prevent COVID, the illness. That's what the vaccine does. They didn't study presence of COVID. Well, the two that we use now did not. The AstraZeneca vaccine trial did actually swab people to see if it prevented presence of virus. And it did to some degree, it did actually quite well, but not completely. So what the vaccine does is prevents the illness. And when they say it's 95% effective, they mean 95% had no symptoms, but it was 100%. Every vaccine that we have has been 100% effective in preventing hospitalizations and death. And I think that's not really out there enough. No one who was vaccinated died. No one who was vaccinated with Moderna and Pfizer was hospitalized. That's amazing. That is the biggest health thing we've done. It's fantastic. So I think that's important when we're trying to encourage people to take it, is that it works so well. It will revolutionize things. Obviously now there's variants, et cetera. So then the bigger question is, does it prevent the spread, right? And again, the trials weren't designed for that. And that's why we tell people that they should still wear masks when in public after vaccine. You won't get COVID yourself, but you could potentially spread it because it could potentially still replicate in your nasal passages and therefore be spread. It certainly is way less likely to do that after you've been vaccinated. How much less likely is the question. But as everyone is vaccinated, that question, that goes away. The goal is trying to get everyone vaccinated. I think we just need to champion how well it works, how much of a modern miracle this is. Their side effects are minimal. I'm vaccinated. I don't have a Russian chip inside me as far as I know. Yeah, that's universal vaccination will revolutionize what's happening. It's going to be tricky to achieve that means, but the more we champion it, the more we show it. The people trust you, that use those trust networks to really champion this.
Thank you. And Kate, I mean, I know we've been working, there's a great collaborative, community vaccination collaborative that's been meeting, that some folks that we work with are kind of sitting in on those meetings to understand kind of what messaging needs to happen. So, this is just like one of those plugs for getting good information out. Kate, do you want to, I'm going to bring you in just to talk a little bit about this, because I wanted to make sure we did talk. And there's some great folks on this call who I know can speak to a broader community about the safety and efficacy of this, because I think we want to get that message out, because that gets our kids, the sooner we do that, the sooner we can get our kids back in school safely too. So Kate, you want to talk a little bit about that work?
Yeah, James, thank you so much. So the Community Vaccine Collaborative is a partnership with UPMC and a number of community organizations and partners to really work on building trust, particularly in marginalized communities across our city. Really focused on building trust with the science community again, and also promoting the safety and the efficacy of the vaccine. Something that was brought up on the call this week, in fact, though, was one of our community health deputies is working in our communities, boots on the ground, said, listen, building trust is going to take us a long time, right? This is going to take us a long time to build this trust up. But what we need to start doing in addition to building trust is similar to what Dr. McElhatton was saying, is talking about the mitigation strategies. The CDC yesterday just came out, double mask. I think Dr. McElhatton, correct me, 95.6%, I believe, is the prevents transmission. So the trust building is going to take some time, and we need to continue to do that and continue to spread that messaging. We have docs from all over the place who are on these calls just saying it's safe, it's safe. We need to get the vaccine. We need people to trust that. But also, okay, we have a lot of time to make up. So we also need to educate people on mitigation strategies and overall health, right? Overall health. If you do not have some of these pre-existing conditions like obesity, if you're a smoker, different things along those, diabetes, then you're not as at high of risk. So I think looking at this from a full health perspective, so we're simultaneously promoting the safety and efficacy of the vaccine, building trust again with the science and research community, and educating people on mitigation and health is just imperative.
Thanks, Kate. I appreciate that. So I look, it's 1:10. I know, we've had a lot of talk. I want to make sure, I know Dr. McElhatton has to get back to her rounds, but I wanted to kind of end on this final point, which is if you could give one piece of advice to school systems that are fully remote right now, right? Or, what would that advice be? And how could we get folks feeling confident again about getting to a place where we're opening and serving the kids, especially those with the greatest needs? And Dr. McElhatton, I'll start with you.
My advice would be the science is clear. With the proper mitigation strategies, school can be done in person safely. A very reasonable goal is to go to work and go to school in a place where COVID doesn't spread, and schools are that place.
Great, thank you. Josh, what would your advice be for folks that your counterparts in other places that maybe haven't opened yet?
Just come to the realization that COVID affects us all. So therefore, everybody should have input into what the plan should be. Also realize that everyone won't be happy with that plan, but the science supports it. And it, like we've all said, it helps the staff. It helps the kids, more importantly, when they're in the building. So lastly, just have that clear plan, have it communicated so that expectations are clear, and implement it, but also be ready to pivot when you have to.
Missy?
Yeah, I absolutely agree with what Josh just said. You have to over communicate. You have to ensure you have accountability to your plan. You have to ensure that your utmost safety is your priority. Look to partnerships. None of us knew how to do this or what to do when, but we did it. You can do it too. I like our term, we're stronger together, and we are. And so, we're all serving the same purpose. Just reach out and ask and lean on each other. We can get through this together. I mean, there is science, there is proof in the programming and the models, and you don't have to reinvent it. Let's do it together.
That's great. Chase, final word. I'll let you speak.
I would say cut it out. If you are exclusively remote right now, cut it out. You're doing irreparable harm to children that will impact their families and their communities for generations. This work is about the kids. It's not about the special interests of unions or adults. It's about the children. Cut it out and go to work.
All right. Well, on that note, I want to say thank you to our panelists for being here. I want to thank all of you who are on the line. I know I saw our union president from the PFT here. I want to thank her for being here. I want to thank Ms. Edwards from the school board, Ms. Bush from the Urban League, my board members, all the members of the Pittsburgh Learning Collaborative that were on the call today. Just really thank you for this thoughtful conversation. And our hope is to continue to talk through, how do we partner, right? To Missy's point, like, how do we share the lessons learned? How can we help? What supports are needed to get there? We stand ready to do that because we know our kids need us to get schools back open safely as soon as possible. So thank you. Appreciate all your time. Appreciate you all so much. And can't thank you enough for joining us today, and to our panelists, thank you. You don't get the joy of a full round of applause. I wish I had like an applause machine back here to give you the applause you deserve. So thanks so much. Have a great day. Have a great afternoon, folks. And if you have questions and you want to send them to me so we can ask to send them out, feel free to email info@aplusschools.org, and we can get those back out to you in our next eBlast. All right. Thank you, folks. Appreciate your time.